I presented work looking at resistance mechanisms on the phase 3 trial of gilteritinib randomized to salvage chemotherapy in FLT3 mutant AML. And what we did was we looked at 40 patients who relapsed on gilteritinib that had paired baseline and relapse samples. And we analyzed them using next generation sequencing for a targeted panel of genes associated with myeloid leukemias. And we noted that the most common mutations associated with gilteritinib resistance were mutations within the RAS/MAPK signaling pathway, as well as a small number of patients that instead developed mutations within FLT3 itself at the gatekeeper residue F691L largely. So the patients were treated on the phase 3 clinical trial. We looked at the patients treated in the gilteritinib arm. We took all the patients that responded and subsequently relapsed and looked for the patients that had paired samples. And again, these samples were analyzed using a next generation sequencing panel. We sequenced them with using a commercial panel called the Archer Core Myeloid Panel that sequences 37 genes associated with AML. And it sequenced the entire FLT3 gene and then targeted hotspots in other genes. The main conclusions are that the most common mechanisms of relapse do appear to be RAS/MAPK gene mutations, and there's only a small proportion of patients that develop resistance due to F691L gatekeeper mutations. One of the most intriguing findings in the study, however, is that some patients do have RAS mutations at the time of drug initiation, and about 40% of these patients, actually 39% to be clear, still achieve some mechanism of complete remission. Just because you have a RAS mutation doesn't mean you might not respond. We're not yet sure why this might be, except that we noted that there were fewer mutations per patient in the baseline samples compared to the relapse samples. So I think that there should be concern if there is a pretreatment RAS mutation, that patient should be monitored very closely for relapse. But the data suggests at this point that you should still try gilteritinib because some of these patients still respond.